information. You have no obligation. Call now. On your side, this is News 12 at 6 o'clock.
Walkers held at gunpoint on the Greenway. Patrols increased, but that's not why officers say you should not.
The rate of others in Richmond County. We investigate what's linking these deaths. But first up tonight, the number of COVID patients at our local hospitals has been cut nearly in half in the last 3 weeks.
It is great news to hear. We want to take a look at where they stand right now. 75 patients at University Hospital. Just 2 weeks ago, they were at 149 patients in-house, almost double what they have now. At AU Health, 91 patients. About 3 weeks ago, they were at 124.
Doctors Hospital now at 46 patients, and just 16 days ago, they had 102. So it's easy to see that trend. If you look at this graph, a steep drop for all of our hospitals starting around the middle of January, and you can see that's after a pretty steady climb starting just after Thanksgiving.
Seeing those numbers, it seems like we've gotten over the holiday surge, which is a huge sigh of relief. But through all of that, hospitals are still battling another big problem, a nurse shortage.
Brady Trapnell talks to our local hospitals about just how serious that shortage is.
Just like many of our local hospitals, the VA is battling a staffing shortage. Here, officials are breathing a sigh of relief as hospitalizations have gone down over the past week or so. Nurses are in short supply, and the pandemic has only made it worse.
We already were down because of the number of boomers retiring and the lack of enrollment into nursing schools.
Dr. Phoebe Wrdw is a nurse recruiter at the Charlie Norwood VA. She says some nurses even quit early on in the COVID crisis.
We've moved staff. We have, of course, decreased the number of surgeries or clinic appointments to accommodate our inpatient veterans.
The nursing shortage is a national problem, and the pandemic made it harder to hire, so the VA is doing drive-by resume drop-offs.
We've done our first one. I received over 50 resumes from that first one.
Nurse orientation is now weekly to get nurses on board quickly.
As we have more staff available, we will go back to meeting those needs that have been postponed.
Dr. Awana Churka University Hospital says more staff should be available, especially over the next several weeks, as COVID-19 hospitalizations have dropped dramatically.
Once people don't travel as much and don't gather as much, that we will see less cases.
University discharged 19 COVID patients in the past 24 hours. And AU is down to 61 COVID patients, easing the strain on the health system.
We may still see some increases, but the hope is that we'll get enough shots in the arms to prevent significant surges.
Health officials say the situation is far from over, but our hospitals can be thankful beds are opening up.
What I do see is a lot less fatigue in the nursing staff. You can see that on their faces.
Reporting in Augusta, Brady Trapnell on your side.
And thanks to all of you nurses. All of our local hospitals are hiring nurses right now. We have information on how to apply on our website.
We also have good news about the vaccine rollout in our area. The sign is up now, the old Stein Mart on Washington Road, the future vaccination hub, where thousands in the CSRA will get the vaccine. This is right by the 2nd and Charles at the Washington Square Shopping Center. We told you yesterday Augusta National is partnering with AU Health and allowing them to use the shopping center as a vaccination site. The clinic opens Monday, but AU Health stresses you have to make an appointment online. Do not show up without an appointment.
A sign of the times right there. And today, a local Publix starts vaccine sign-ups. You can now schedule that appointment at a Publix pharmacy in North Augusta, at the North Augusta Plaza, to get your vaccine. The first appointments are for this Saturday. Right now, you still have to be in that Phase 1A, and we have the link to Publix sign-up page online at wrdw.com. On the Georgia side, the Publix stores on Washington Road and Evans and Furys Ferry and Martinez also have vaccine doses. And you can also check in with any Kroger pharmacy in Georgia.
With fewer COVID patients now, University Hospital is relaxing their visitation policy. So from 9 a.m. to 6 p.m., one guest will now be allowed per day for inpatients, outpatients, and people in the ER. Mothers about to give birth can also have one support person and a visitor now. Everyone has to wear masks still, though. University put tight restrictions on visitors about 2 months ago at the beginning of December, and now they have fewer COVID patients than they did back then. So this is good news, easing up on some of those restrictions for families. Taking a look outside over Aiken. Police are still looking for this man accused of robbing two people at gunpoint as they walked on the Greenway in North Augusta. We know many of you are concerned, so many of us use the Greenway, but it's still one of the most clicked on stories on our website. Nick Proto is live on the Greenway tonight, spoke to public safety. So, Nick, how common is something like this? We certainly don't hear about this often.
Yeah, North Augusta Public Safety tells me incidents like this are extremely rare. They're still looking for that suspect in the robbery earlier this week, but they tell me in the meantime, don't let this incident keep you from getting out and going on the Greenway.
We don't have a whole lot of criminal activity on the Greenway.
Lieutenant Tim Thornton with North Augusta Public Safety says the agency gets more calls for medical issues than criminal issues.
Those events are extremely rare. Any type of criminal behavior that we encounter, it catches us off guard to the point where we're surprised.
It surprised people who were walking the Greenway that day, too.
Yeah, so we were out just walking, actually running the other day, and we didn't know what had happened. We just saw a bunch of cop cars and undercover cop cars down where we parked our car.
Lieutenant Thornton says the department has put extra patrol on the Greenway to give people peace of mind, and he says the incident shouldn't stop you from coming here.
As a matter of fact, I was out here yesterday exercising, so I wouldn't think twice about coming out here.
We also checked in with Richmond County about incidents at the Augusta Canal in the past year. They've recorded 9 incidents in the last 12 months, just 1 assault. Officials are still looking for the suspect in Monday's robbery. In the meantime, Lieutenant Thornton says travel in pairs and use your judgment while on the Greenway.
Be aware of your surroundings. Be alert to what's walking down the trail at you.
I know we like to travel light when we run, don't like to carry too much stuff, but Lieutenant Thornton says even if you bring something like a whistle or some pepper spray in your hand while you're running, it could deter people from picking you as a victim.
Really good perspective there, and it's good to know that it's pretty much as safe as it feels out there. Richard?
Well, Augusta could be getting a cemetery for veterans. Now to an all-new I-Team investigation, the missing link. We found people living in one part of Augusta are dying of COVID 5 times the rate of others across Richmond County.
We found the element linking these deaths are food deserts, families that do not have access to healthy foods that boost their natural immunity and their overall health. I-Team's Liz Owens talked with experts about Augusta's food deserts.
This is a USDA heat map of food deserts in the United States. If you zoom into Richmond County, you can see the vast majority of the county does not have access or a way of getting healthy fruits and vegetables. We took another map of COVID deaths in Richmond County and found both maps line up. Take a drive through the Harrisburg community in Augusta. You'll see people on foot or on 2 wheels.
A lot of people walk or ride their bicycles.
They're the only modes of transportation for more than 30% of the people living here. Nancy and Rebecca Birchfield are more fortunate than many of their neighbors. They have a truck and drove to meet us.
Buses can't get down through here with the roads. They have to come broad streets where they pick up and let off.
If you're elderly or disabled, it kind of limits, getting on the bus and getting around.
The city bus is only an option to those healthy enough to walk to the nearest stop and who can afford the ride, which is not many. According to a nonprofit that collects demographics based on zip codes, nearly 70% of the people here do not have a full-time job. Nearly half live on less than $25,000 a year.
The access to food and the way to get there is probably the hardest thing.
The Birchfields used to shop at the Kroger on Wrightsboro Road. It's now a furniture store. All that remains of the Kroger on 15th Street is a parking lot. The nearest grocery store still open is more than 2 miles in either direction, leaving the Family Dollar as the only source for groceries for many in Harrisburg. When the I-Team stopped by to shop, we found no fresh fruit or vegetables, only frozen options or fruit cups that often come with added sugar.
So you're left eating canned goods, which, do have a health quality to them, or a lot of boxed processed foods. So, and that's what we see in Harrisburg.
Rebecca Von Lennon is the director of Augusta Locally Grown.
Those are the areas that have the lowest immune systems, lowest access to healthy foods, and also highest rate of diet-related diseases.
She's right. A study by Duke University shows residents with a chronic lack of access to adequate food resources are shown to have higher rates of diabetes, obesity, and cardiovascular disease, all of which are risk factors for COVID-19.
Does it surprise you that, we found the highest COVID deaths are in food deserts in our area?
From a data standpoint, it doesn't surprise me.
The I-Team tracked COVID deaths in Richmond County by zip code and found people living in food deserts are 5 times more likely to die of the virus. 20 people died of COVID-19 in Harrisburg in just the first 8 months of the pandemic. 30909 is also a food desert. 28 people died of the virus there. South Augusta, another food desert. 39 people. In comparison, only 1 person died in zip code 30805 and 3 in 30813, where there are plenty of nearby grocery stores.
We've had a couple of our neighbors that have had issues with it. We know we had one lady that lost her mother.
Yeah.
And it's been hard.
Nancy herself was high risk for COVID until she joined Augusta's vegetable prescription program.
I lost 45 pounds in that 6 months. My A1C came down from 14 to 9 the first 6 months. And then my blood pressure medicine, I was doubling it. Now it's half.
Her results are not unique. The I-Team found Augusta University analyzed several years' worth of data from more than 100 participants in the program. All, like Nancy, had diet-related diseases and lived in food deserts. Each participant received a prescription to purchase fruits and vegetables from local farmers. They also attended monthly clinic visits and plant-based cooking classes.
About 1/3 of our program participants every year either completely go off of their blood pressure medicines or their diabetes medicines, just right off the board. But about half of our program participants that graduate see a decrease of their blood pressure medicines as well as their diabetes medicines.
My immune system is one of the biggest things that was an improvement for me.
And improving her chances against COVID-19. Not only did the physical well-being of people improved under the program, but also their mental health. The study was published over the summer, the first of its kind in the nation. Liz Owens, on your side.
Really is fascinating when you realize what you eat has such an impact, and if you don't have access, you don't have access. The Republican primaries for North Augusta races, those are now just 5 days away. Many kids now back in person in class, including here at home. Now teachers across the 2 states are asking to be vaccinated now. We're going to tell you when that could happen on both sides of the river.
If you've been hurt in a car wreck, what are you waiting for?
Call George Sink Injury Lawyers at all 9s now.
The sooner you call, the sooner they can help.
George Sink Injury Lawyers has the experience to help you get your money fast. If you've been hurt in a car wreck, call all 9s.
A time to celebrate Black History here in the River region. Several events coming up in honor of Black History Month. This weekend, there's Culture Fest at the Indoor Flea Market. That's on North Leg Road. They'll have food, music, shopping. In 2 weekends, a live-streamed performance of the play The Mountaintop, put on by the Augusta Players. You can buy tickets online, and you'll be emailed a live-stream link to watch that. And February 27th, there's a jazz concert at the Leslie B. Price Center. Tickets are on sale at the Smith Hazel Center in Aiken.
Time for a check of the weather now as we give you a lot. Thanks very much. Georgia Governor Brian Kemp touring a Kroger in Atlanta today that will double as a vaccine clinic, and he spoke with pharmacists about the Moderna vaccine and how it's being handled there at the distribution at the store. And he again called on the federal government to provide more vaccines. As Governor Kemp tries to get more doses to hospitals and those pharmacies, he's been getting a lot of heat from teacher groups about vaccinating our educators. Just last week, the governor said we don't have the supply of doses right now to start vaccinating teachers. The state's still working to vaccinate healthcare workers, first responders, seniors, and others in Phase 1A of the rollout.
In South Carolina, Governor